Hello, and welcome to the case walkthrough for the Community Health Nurse Experience case. My name is Lauren Malmgren, and I'm a registered nurse that works at SimX. I'll be taking us through this case walkthrough today. Now, before we get started with this case, it's always a good idea to make sure that your in-headset user has an opportunity to orient themselves to the environment. And as you can see, as we look around, we're in a beautiful mosque environment with a free clinic setup. And as we take a look around the room, you can see we obviously have our patient here. We've got a trash can, a sharps container, a mayo stand here with a variety of different supplies on it, Band-Aids, cotton balls. We've got a folding table here with some different documentation. We've got some brochures that we can give to the patient. We've got our gloves and our masks for our PPE. We've got a scale and a height rod. We have another mayo stand here that has a variety of different assessment tools as well. Stethoscope and our blood pressure cuff with the glucometer, as well as a point of care triglyceride and cholesterol measurement, a thermometer, and our EMR tablet. And this case, this patient is here for a free health screening. And so to start off, of course, we're going to introduce ourselves to the patient. Hello, my name's Lauren. I'll be the nurse taking care of you today. How are you doing?
I'm good. How are you?
I'm doing well. Thanks for asking. Do you mind if I get your full name and date of birth?
My name is Muhammad Akhtar. February 20th, 1951.
Oh, wonderful. Well, it's lovely to meet you, Mohammed. Now, as we said, this patient's here for a free health screening, and so it's going to be a good idea that we go through his health history. And so we can ask the patient, Mohammed, have you ever been diagnosed with any health conditions?
I was actually diagnosed with high blood pressure and depression and anxiety at a free clinic previously. But I'm having trouble affording the medications I was prescribed.
What medications are you prescribed?
I take lisinopril and fluoxetine every day.
Every day. Okay. Well, if you're having trouble affording those medications, I think we might be able to help you with that. Are these the medications that you brought with you today?
Yes.
Okay, we'll take a look at those. And we've got lisinopril and fluoxetine. Now, we can also do a full assessment on this patient. We can start by listening to heart and lung sounds. And we can listen to bowel sounds as well. Okay. We can put a blood pressure cuff on this patient. We can take his temperature. And we can also take his blood sugar. And so we can start with an alcohol swab. Swab off his finger. Put that in the trash. Grab our stylet and our glucometer. We've got 105. And I can put this stylet in the sharps container. I can also have this patient stand on the scale so we can measure his height and weight and make sure that he's at a healthy BMI. Mohammed, would you be able to get on the scale for me?
Okay.
And we can grab this height rod and pull it down. And then we can look at our screen here and see that he's 165 pounds, 171.5 centimeters. And we can change that to be in inches and kilograms if we need to. We can also, going back to our EMR tablet, use this to calculate his BMI. So if we go to clinical calculators and then to BMI, we can input his height and weight and then get a BMI reading from that. He's 165 pounds and he's about 5'8". We can input his ethnicity, and then on this screen we'd be able to see his BMI. Mohammed, do you want to sit back in the chair?
Okay.
Another aspect of this case is to make sure that this patient has access to all the resources that he needs to make sure he can adequately take care of himself and his health. In our previous conversation with the patient, he mentioned he was having trouble affording his medications. And so going back to our table with all of our brochures and documentation, we can pick up this brochure about pharmacies and hand that to him. And of course, we can have a whole discussion with him
Thanks.
about that. And then he can put that in his satchel so that he can take it home. Another aspect of this case is to make sure that he's up to date on all of his vaccines. And so we can ask Mohammed, when was the last time you had your flu vaccine?
Yes, I got my flu shot last year.
You got your flu shot last year. Are you interested in having your flu vaccine this year?
Yes.
You are? Okay, wonderful. So once we've established that he's interested in having that vaccination, we can make sure that he fits the criteria for that vaccination. So we can come to our screening questionnaires and go to the influenza vaccine screening questionnaire and make sure that we filled all of this out. So we can ask him, do you have an allergy to eggs or to a component of the influenza vaccine?
No.
And we can mark no. And you can continue to fill out the rest of that questionnaire. And once we've established that he's a good candidate for the flu vaccine, we can make sure that he's signed the consent form. And so we can come back here and hand this to our patient. Make sure we've explained everything to him, and then once he feels comfortable, he can sign that. And once that's signed and we have that documented, we can bring that back here. And now we're ready to administer this vaccination. So we'll do our hand hygiene, and we'll put on some gloves. And we can ask the patient, what arm would you like your vaccine administered in today, Mohammed?
I'm right-handed, so you can put it into my right arm.
Okay, wonderful. Do you mind if we remove your shirt?
No.
Okay. So we can remove the patient's shirt, and then we can draw up our medication. So I can grab my syringe here and my vial of medication, and we're going to give him 0.5 today. Grab an alcohol swab and administer this intramuscularly in his right delt. Wonderful. And then we can put our alcohol swab in the trash and our syringe and needle in the sharps container. We can also use a cotton ball to get any blood and then a Band-Aid. All right.
Thanks.
So that is it for this case walkthrough for the community health nurse experience. As you can see, this is a really great case to help community health nurses or prospective nurses get some experience in a community health environment, as well as establish some of those soft skills for communicating with patients therapeutically.